Hi, I'm Dr. Joshua Taylor. I'm a general surgeon with the surgical clinic in Rutherford County, and I wanted to talk today about a new procedure that I'm offering called Transoral Thyroid and Parathyroid surgery. The surgery is focused on performing surgery through the lip and accessing the neck and performing traditional thyroid and parathyroid surgery. The benefit of the surgery is that it essentially removes the scar. Patients will no longer have a scar on their neck that would be visible after they've recovered from their surgery. And that's profoundly important. We think about a lot in breast surgery, breast cancer surgery, that we want to perform reconstruction and have women be able to essentially live a normal life without being reminded or certainly having people aware that they've gone through something like that. And so in a very similar fashion, transoral thyroid surgery is a way for patients to no longer have a scar that's visible. There's some very interesting medical studies that have been done on the impact a scar has on patients, specifically for thyroid surgery. And it's one of the highest rated things that they talk about post-operatively. There are a variety of complications or issues after surgery, but the scar is one of the things that patients actually focus on the most. And I think certainly as surgeons, we don't necessarily give enough credence to that and enough importance to that. And so this is a way that we can overcome that and have patients be able to essentially live normal lives. The surgery is, as I said, performed through the lip, but we perform essentially the traditional surgery. We can remove one side of the thyroid or both sides of total thyroid surgery. We can also remove some of the lymph nodes that live in the lower neck if that's necessary. In addition, we can perform parathyroid surgery. The little small glands that live behind the thyroid that sometimes are affected can also be removed through this approach. To my knowledge, this surgery started being performed in the United States in about 2015, so about 5 years now. Johns Hopkins is one of the centers that has the most experience since that time, and actually attended a teaching course and a course in which I did a dissection on a cadaver performing the procedure at Johns Hopkins to learn how to perform this. And so this is now within the medical literature. They've published a little over 3,000 cases here in the US of people having this procedure performed. And so they've done a lot of that research into the risks and the complications, and it's all been very, very similar in terms of comparing the newer approach to the open approach. There are some other what we call remote access approaches to thyroid surgery. So there's some surgeons that perform the surgery through incisions in the underarm or beneath the breast. And this actually has a better risk profile because those are big spaces you have to create to get up to the neck. It can be very hard to do surgery on both sides of the neck. And so this approach kind of helps alleviate both of those issues as well. So a patient would come in the day of surgery. Typically, this type of surgery does take a little bit longer than the traditional surgery, but after surgery, they would then plan to stay in the hospital, usually just overnight. And that's just monitoring to make sure that there are no issues after the surgery. As I mentioned, there are stitches inside the mouth, but there aren't any necessary bandages that have to be placed in the mouth. We do have the patients wear a little bit of a compression just to help prevent swelling within the neck for the first 24 hours. Diet-wise, we'll start with kind of a soft diet, make sure they feel okay, and then they can advance pretty quickly after. So complications with the transoral thyroid surgery are very similar to potential complications from traditional surgery. So when we perform the surgery, there are very important nerves that go to the voice box, and we're monitoring those nerves and making sure that we identify and protect those nerves during the surgery, regardless of how it's performed. The parathyroid glands, if we're not doing the surgery on those parathyroid glands, we want to be very careful that we identify them and protect them. And so the complications that are unique to this type of surgery as opposed to traditional thyroid surgery where we go through the neck are just related to where we make the incisions in the bottom lip. So patients will have some stitches after the surgery in the mouth that will absorb or go away within a couple days. After surgery, they need to keep their mouth clean after they eat, so we usually have them do a rinse after eating. And then there can sometimes be a little bit of numbness along the lower lip just from where we did the surgery, but that typically resolves. One of the biggest contraindications would be the size. So if somebody has a large thyroid or a large nodule, that can be difficult to remove through this. We're creating a very small space internally. We're using advanced instruments with robotic surgery. And so if you have a large thing that's taking up that space, it'd be very hard to perform the surgery. So sometimes those patients would need the more traditional surgery. And then it also sometimes depends on if this is a thyroid cancer, where the cancer sits, making sure that we get the cancer entirely removed and things like that. It can be very important to think about how we perform the surgery. Certainly if patients have ever had previous neck surgery, sometimes the scarring won't allow us to develop that space that we need to be able to perform the surgery.